and they have introduced these new pills, which are also approved when it comes to UAE. And on that note, let's have Dr. Yasmeen Ajaz, endocrinologist, and very much on air with us. It's so nice to have you on Talk 100.3. Point 3 ho gaya. Dr. Yasmeen, how are you doing today?
I'm doing fine now.
Okay. But what about this matter that we take around with us in the form of weight, Dr. Yasmeen? Doctors are trying to make it even more easier. Earlier, there were injections. You inject yourself and lose weight magically. And then it comes back as well, Dr. Yasmeen.
Yes, definitely when you talk about the weight gain or weight loss, it's a big issue. And if you want to first do it naturally, the best thing is to increase your physical activity.
Yes.
Okay, so that you can do walking, jogging, cycling, whatever you want. And you have to adjust your diet. Mainly eat more proteins and, more vegetables and fruits. Try to avoid highly processed carbs when possible.
Basically, Dr. Yasmeen, your losing weight journey starts in your kitchen.
Definitely. And make sure you take a very good sleep, at least 7 to 8 hours. That also helps you in maintaining your weight.
Dr. Yasmeen, when it comes to patient these days, we are throwing more challenges towards you and you have to catch it. And many of the doctors are doing that so well. First was losing weight. I'm not able to lose weight. Now, because of these unnatural things but approved, that is injections and pills, people have lost weight successfully. But it just runs to you. It just comes back, Dr. Yasmeen. Have you faced that kind of challenges with your patients, with your clients, where they come back and say, what to do now? It's coming back and I don't want. It's, love lost, but that kind of love that is coming back to you.
See, first thing we have to understand that obesity is a chronic disease. Like diabetes, like hypertension. You don't stop medications. You have to carry along.
Sure.
Unless and until we understand that obesity is a chronic disease, we can't overcome it. We have these magic pills, magic injections, which have revolutionized the management of obesity. You lose a lot of weight, but if you stop it suddenly, you again start going back.
That's right.
And you start gaining weight. So what strategies we are using? We are trying to encourage healthy lifestyle. We are telling them to have a positive approach, and we start them the medications. And the very good news now for the UAE that we have pills available, which are doing wonderful job and have been approved by the FDA. And luckily, UAE is the first country after US that they got the pills approved. Both we have a Wegovy pill and we have Fundio, which is available in the market now.
Dr. Yasmeen, why do we say approved? It is after research that, there are no major issues or heavy or dangerous side effects. That's the reason that they wait and they research and then they approve?
See, any drug which comes in the market needs approval by the approving authorities like the FDA or the EU approval. They go vigorously over the 5 years. There are phases, clinical trials, which make sure that they are safe, they don't cause side effects, and they are good for the disease they are supposed to be used. So it is a 5 years, 6 years. Then they present their data to the FDA, and the committee sits and they assess all the side effects, all the positive and negative things, and then they approve the pill. Then after that, there's a post-marketing surveillance also, which goes to make sure everything is on the track. So it's not like that you got a pill and it's approved. It takes a lot of research, a lot of money, and a lot of manpower.
And at 5 years are enough for research, Dr. Yasmeen?
Yes, 5 years are more than enough because it is retrospective. It starts early. There are phase 1, phase 2, phase 3. So when there are the recommendations, what should be the values, how they go ahead. And then finally, all the data is put for the FDA and they approve it, and subsequently these data also comes in the leading journals like Lancet, like NEGM, like Nature, and then the FDA gives approval.
Sure. So now what we have learned so far when it comes to these injections as well, Ozempic or, likes of that, they put you on a 3-month course, similarly with these pills as well. But now the thing is that once you manage to reach your goal, it comes back. So then will there be a break, Dr. Yasmeen, and then back to another 3 months course? How does that work when you want to maintain your weight?
See, what you see when you put the patient on injections, be it like Wegovy, Ozempic, or Manjaro, okay, you start losing weight very nicely, and a time comes maybe in 6 months, 1 year, you are about to have the weight which you want to be, the desired weight,
1 year.
and at that time, the question is how to proceed further.
Okay.
If you stop it abruptly, you'll again go on. Okay, the hunger hormone will be more, and the satiety hormone will go down, and you'll start gaining weight.
Oh.
But now, what the trials have shown that you can try to decrease the dose. Suppose somebody is on a big dose of Manjaro, say 15 milligrams weekly. We can try to keep him on 5 milligrams every week so that he can maintain the weight. Or the second thing is now the pills have come. You can switch from injections to pills, which might help you in maintaining the weight. All said and done, we have to understand as patients, as doctors, that obesity is a chronic disease. Technically speaking, you cannot stop the medicine all of a sudden.
Okay, so it just sounds like Dr. Yasmeen कि बस सारी जिंदगी आप गोलियां ही खाते रहो पतले होने के लिए और मेंटेन करने के लिए that is something at times sounds very dangerous, that just to maintain weight as well you have to keep consuming, and now that they are in pill form, all the more easier. Just pop a pill every day and you're good to go.
Yeah, and the new pill which has come, the Wegovy pill, it's not only for losing weight. It gives you more benefit for your heart and kidneys, cardiovascular health. Yes. The data is clear that now, even if you are not diabetic, you're only having more weight, and you use this pill, it will decrease your weight, and you will definitely get 20% reduction in terms of getting heart attacks or strokes, which is very interesting. It is just buy one, get one free. So to me, this pill is a game changer, and luckily we know the UAE government, and they have approved this pill. So it's a benefit for those people who don't want to take injections.
And imagine,
they can take this pill.
Dr. Yasmeen, imagine we are talking about this at a time when, Eid has just passed, and when it comes to festivities and so many holidays, you tend to indulge so much of meat and then sweet, and then you're back with the treat, and now the treat is in a form of pill. How much do you, recommend people to first approach their doctors responsibly, sensibly, because they are available over the counter as well, Dr. Yasmeen, and some, we all have a little doctor inside us every now and then, and with today's times of the AI, people feel that we don't need the doctor anymore. We can just do our research and start on a self-prescribed course. Do you approve that, or this can be very, very dangerous?
No, definitely. Whenever you take such kind of medicine, you have to go to your doctor, make sure everything is okay, and you are ready for the pill. See, the pill has a lot of side effects also. It can cause constipation, it can cause diarrhea, it can cause gases, it can cause a stone in your gallbladder, which is very less, but the chances are there. And if somebody has a history of cancer of thyroid, which is called the medullary cancer of thyroid, at that time we don't give this pill to the patients, even if it's in the family. And it sometimes, very rarely, not rarely, 1 in 1,000 can cause inflammation of the pancreas. So that is why it should not be taken as an OTC, over the counter. You should see your doctor, discuss with him, and most important thing is, who is the candidate. We see people coming who are not obese, who are not overweight, but they just want to fit in their wedding dress in the coming 3 months or 2 months.
Size 0, Dr. Yasmeen Ji.
Yes. So the guidelines, as per the guidelines, any patient who has a BMI of more than 30 kgs is a candidate, or if somebody has a BMI of 27 plus diabetes or hypertension or cholesterol issues. So make sure that we make the people understand it is not for everybody. It's for those patients whose BMI, body mass index, is more than 30 kgs per meter square, or 27 plus a risk factor. So I see in my hospital, my clients are coming, they're telling, can we take? So I explain to them that it's not for you. So if you should use it properly, and it should not be over the counter. You should see your doctor. He will do some requisite tests first, and then you can go ahead and use his medication.
So I think a better way to approach is, Dr. Yasmeen, that we do all our research but have the final recommendation, suggestion, treatment left to their doctor.
Definitely. It should be the doctor who should take the call, whether you are a candidate for these injections, weight loss injections, or the magic pills.
And so this sounds to me like once you start consuming them to maintain your weight, that's what we are focusing on, then it sounds like lifetime, is it?
See, patients sometimes respond because they have a positive behavior. They go for the diet. They go on vigorous exercise. They cut down their carbs. I have seen in my clinical practice a lot of patients who tapered over 6 months to 1 year, and they did not need it. But if you see the thing, it is a maintenance, and what maintenance means, not the same dose what they are taking, not the same frequency. Probably we decrease the dose to the very low dose, and we might even increase the frequency of the injections. So obesity is a chronic disease, and managing it is that you need to focus on your weight and make sure that it is a long therapy. You don't expect magic in 2 months, 3 months. You will lose weight. Definitely in 2 months, 3 months, 4 months, 5 months, you might lose in over a year and a half around 30% of your weight. But make sure that you taper it very slowly.
And have you been successfully, diagnosing people or prescribing it to them? Have they come back with any major issues or complaints so far, Dr. Yasmeen?
Well, as I told you, all these pills and injection, the commonest side effect is the GI side effects, means the gastrointestinal. They can have nausea, vomiting, constipation, diarrhea, flatulence. This is the commonest side effect, which is in a lot of patients, and it goes off once you escalate the dose, and with time it goes off. And this is the major complaint. And otherwise, I have seen a couple of patients with pancreatitis, and more than 1,000 patients on GLP-1, these injections. A couple of patients acceptable, and once we have it, we stop the medication, and the patient becomes okay.
Okay, so in that case, you immediately ask them to stop taking it.
Yes.
Yeah.
If the patient is taking the dose and he feels severe abdominal pain, he feels is not comfortable, he should immediately come to his doctor, and the doctor will advise him what to do further. And the most important thing which I tell my patients is to follow the dosage schedule. What I have seen, patients are using big doses. They take the injection from the pharmacy without asking their doctor. They take a big dose and they land up in the emergency with vomiting and diarrhea and abdominal pain. So the dosage, specific dosage, escalation is as per the guidelines so that the symptoms are less.
And this is also imperative, Dr. Yasmeen, to talk about Novo Nordisk, very popular name these days now, because that's the company that developed Ozempic.
We have Novo Nordisk, which makes Ozempic or Wegovy, and now they have come with the Wegovy pill.
Yeah.
And also we have Lilly. They also have the Manjaro and the Fundayo. So these are the two main players in the market, which have revolutionized the management of obesity.
And Novo is in a lot of trouble in US, Dr. Yasmeen, because it has been sued by patients alleging serious side effects, stomach paralysis, intestinal problems, vision loss. What would you say?
No. See, the first thing is side effect profile is always mentioned in the leaflet. If you open the leaflet, how do these medicines mainly work? They decrease the motility of your gut. Okay, so you will expect some problem in the mortality, but there is nothing like vision loss. Vision loss has been reported. It is basically in diabetic patients when they decrease the blood sugars rapidly. So when we have the diabetic patients, they always do an eye checkup first. But as of now, it's considered to be safe. The medications are very safe. The outcome is brilliant.
And also, I must mention that something else has also come to the surface, that some people are also selling knockoffs, Dr. Yasmeen. And these I've learned, are the compounded semaglutide products against counterfeit of Ozempic sellers. I'm not sure, it might not be available in UAE, but if, for the price factor, you go outside UAE and maybe buy those dupes or knockoffs, then you're asking for trouble?
See, always remember that nowadays in our market also on WhatsApp and TikTok there are fake peptides which are being sold. There is a peptide which is called retatrutide, which is not yet come in the market. It will take still 6 months, but I don't know how they're selling it. They're all fakes. So my suggestion to the people, please don't go on this TikTok and WhatsApp. Go to your doctor and make sure you take an original medication rather than a fluke.
That's right. Dr. Yasmeen, you've been very kind, answering all the questions that we have posed to you. But end of the day, it's health. And who wouldn't want their patient to reach their goal and be the biggest loser or a maintainer when it comes to after losing weight, taking care of your health? Now, quickly, what should be taken care of once you reach and you are happy and healthy, maintaining that weight as well? The diet, what should be consumed from superfood to regular food, Dr. Yasmeen?
See, the first thing is whenever you are on these medications, try to increase your protein intake. That's very important because when you are using these medications, you don't lose only fat.
When you say protein, sorry, Dr. Yasmeen, when we say protein for our, Desi listeners, what is a good source of protein for a veg and non-veg both?
So you can use lean meat, you can use fish, you can use eggs, you can use dairy, you can use legumes, you can use tofu. Tofu is a very good source of protein for the vegetarians, legumes for vegetarians, egg for vegetarians. So you have everything: lean meat, fish, dairy. They're all having a high protein intake.
And this should be part of your everyday diet or every meal?
Yes, everyday diet. Okay, you can fill your plate with vegetables. You can fill your plate with fruits. You can choose whole grains and not use processed carbs when possible. The bottom line is you should reduce all sugary drinks. Try to avoid desserts and pay attention to your portion size always, because when you are on this medicine, you will not be able to eat much because the gastric motility is decreased. You might vomit. So you have to pay attention to your protein size also.
So you said that reduce your desserts means less sweet, Dr. Yasmeen. I mean, what is this?
Yes. Yeah, suppose maybe a spoon, 1 spoon of.
That is for tasting, Dr. Yasmeen. Whether we should. So that means you don't have a sweet tooth, and you can. There you go. So when are they going to invent a pill or maybe a structure where other people go to the gym and we lose weight, Dr. Yasmeen?
It's now available. So you take a Wegovy pill. If you take a Wegovy pill, do nothing, you'll still lose weight.
True. But the more, of course, like you said in the beginning, the natural way is the best way. But if it's posing threats to your life,
one of my clients came to me. He told me, obesity runs in our family.
Oh.
So I told him nobody runs in your family.
Well said, Doctor. And on that note, thank you so much for joining us. I'm sure these days people are running to their doctors, at times pharmacies, which is not a good idea if it's without prescription, to get these injections. Now, even simpler form, and that is a pill approved by UAE, of course, health sector. And you shed so much of light on that. Thank you once again.
Thank you. My pleasure.
There was Dr. Yasmeen and Dr. Yasmeen Ajaz joining us, endocrinologist.